Society at the moment is undergoing an epidemic, and it's one that's been insidiously brewing for over 100 years. It's due to bad lifestyles, bad nutrition, and it's affecting our society both economically, emotionally, and socially. We are here to address this problem and talk about the solutions. That's why we have our guest over here. He has a master's in pharmacology. He is the CEO of Curo Health, which is the largest nursing fleet in South Africa. And he has his PhD in entrepreneurship from Stanford University. Please welcome Dr. Richard Botha.
Thanks, Jordan.
So Richard, you know very well that the epidemic of chronic conditions in South Africa is causing a massive issue for people. And the worst part about it is that they don't actually know exactly that it's affecting them. So what would be some of the solutions as to why medicine at the moment can't treat it or falls behind? And what can we do to sort of find a way to work around it and treat these conditions?
I think the answer is pretty simple. People believe in miracles when they go to the doctor. And the miracle comes in the form of a tablet or a capsule. And people think that they don't have to take accountability for their own health. So to give you an idea, when a patient goes to your doctor, and typically that's where you start when you don't feel well. Mm-hmm. By the time that the patient leaves the front door of the practice, they retain about 75% of the instructions the doctor gave them.
Yeah.
By the time they get home, they retain about 12% and they share 8% with the family. And 24 hours later, it drops to 2%. Mm-hmm. So I've asked hundreds and hundreds of doctors, and the answer is always the same. I ask them, so how many patients sit in front of you with a notebook that they can actually write down the instructions you give them and report back on side effects, on new symptoms, and anything else that's going on with their health situation? And the answer is always no, never. So the problem is that we live in a state of abundance that this planet has never seen. And people think that health comes automatically. It's like personal growth. People think it just happens automatically, and it doesn't. So if you do not take accountability for your own health and make sure that you have an optimal, healthy lifestyle, it's not going to happen automatically.
Yeah.
So that's the biggest problem. We live in this instant gratification situation. And I saw a joke the other day. When we grew up, your mother would say to you, you will sit there until you eat all your food.
Yeah.
Look at all the obese people out there.
Now it's a problem.
Yeah, now it's a problem. Let's blame our mothers. So, but we, as a society, we live a very sedentary lifestyle. We eat processed food. And if you just take the time to go and look at processed food, the real poisons that's in there. So we don't live like 100 years ago. We lived from the farm to the plate, and we all ate fresh food, and we did a lot of exercise. And yes, 98% of people were involved in physical work. Today, 2% of people are involved in physical work.
Yeah, so, completely inverted.
Yeah. So you see the scourge of obesity, and that is the leading indicator for all chronic conditions. It's not the only one, but it's the leading one. So you go, you become obese, and the 6 ugly cousins come with it, and it's the high blood pressures and the diabetes and the autoimmune diseases and all those kind of things follow that. And we know now from statistics in South Africa that 65% of adults has got 2 or more chronic conditions.
Sure.
85% of them are undiagnosed. So people find that they don't have energy. They're lethargic. They cannot do what they used to do in the good old days.
Yeah.
But yeah, you weigh 40 kilos more than what you used to weigh in the good old days. So, and the other side of that coin is, especially in our country, is that you have a very fast diminishing workforce in healthcare workers out there. for the first time since 1948.
Why would it be diminishing?
People are leaving the country.
Okay.
People are not qualifying as healthcare professionals anymore at the rate that we should. Our population growth is far outstripping the supply. So, for the first time since 1948, we've got less than 4,000 practicing GPs. We've got 81 cardiologists practicing in private practice. We've got less than 100 dermatologists. We've got less than 200 pathologists. We've got less than 300 radiologists. So the supply and demand issue is there. So if you're a patient and you've got a chronic condition, you will spend less than 1% of your lifetime with a medical service provider.
Less than 1%.
Less than 1%. So 99% of your life, you are on your own and with your family.
Yeah.
Nobody in the family gets a chronic condition on their own. It affects the family. Until the family understands what their role is in supporting the individual with a chronic condition, it's not going to work. So we are dealing with an epidemic, a pandemic, which is actual. We can see it. And the amount of people that become incapable of economic activity is growing by the day. So that is what we're grappling with. And that is the big issue that we identified and said, people need help.
Yeah.
And that's probably what we're going to talk about. But people need, we are in Rugby World Cup time. So
very exciting times.
Very exciting times. When the team performs fantastically, the team is brilliant. When the team loses, they blame the coach.
Yeah, he's the worst coach ever.
Yes.
Terrible. Should have got someone else.
Exactly. So we all need coaches, and especially in healthcare, where you've got so little access to medical professionals, you do need a coach, and it's very new. And we've introduced it now in South Africa, and it's going extremely well. The market is very excited about it. For the first time, you can actually ask a medical professional questions about your own health and what you should be doing about it, and get the right information, and have that accountability partner that has got a vested interest in your health, and not just seeing 6 patients per hour that I can maximize my income. So, and obviously we're using technology, which we'll talk about later, to be able to scale that to a huge amount of people that we can help. Yeah.
The coaching is a new aspect into South Africa. It's quite prominent in Europe and America. But what would be some of the stigmas that the South Africans have had to relieve in order to use a coach? Because right now, like for instance, if they hear, I don't need a coach, are those stigmas really there? And then how would we be able to overcome that and actually get it across, get it in the right mindset of the people?
It is a mindset, because for a long time, today, when I don't feel well, I go to the doctor / God, because that is the default setting of society. I go to the doctor, I get my miracle piece of paper, and then everything goes away. What I tell the doctor is confidential, and nobody will find out, which is stupid, because everybody finds out. Everybody can see if you're morbidly obese, or if you had a lower leg amputation or whatever. That mind shift of having a coach that keeps you accountable for your actions on what you do with your health, that's the scary part. Because the moment people need to report back on what I did or didn't do, now suddenly it's uncomfortable. And people don't like being uncomfortable.
Yeah. Rather avoid that and keep their head under the ground.
Yeah, I'd rather watch a reality show on TV than get off the couch and go and walk around the block. Or I'd rather eat fast food than preparing proper whole food myself. And putting the thinking into that on what am I doing to my health? And how can I optimize this earth suit that I've been given so that I can live a long and healthy life? And I always say to people that we work with, it is, imagine that you have got brain function and the heart is beating. You've got a nappy on your bum and somebody must turn you every 2 hours and you've got a tube in your nose that they feed you.
It's no way to live.
There's zero quality of life. But legally you're alive and somebody must look after you. A lot of people end up there because they neglected their health when they were young, and that resonates when you're old. We see a massive increase on strokes in younger people, heart attacks in younger people.
Cancer as well.
Cancer in younger people, IBS in younger people. Things that used to be old people diseases are encroaching on the younger generation. And I mean, we are seeing patients in their 20s that have heart attacks, that have strokes, something that didn't happen before. So to take care of your health and to make sure that you've got somebody that is your accountability partner that can give you information that you can ask. I mean, I've had people phoning me from the local grocery store to ask me after we taught them to read a food label. So it's got this and this in. Do you think you can eat this? No, you can't eat it because you've got this condition and that will aggravate that. We are employing tech now. So in the app that we're developing now, we're using AI that you can just scan that food label and it will tell you, looking at your medical history, if you are able to eat that or not.
It's like a doctor in your pocket.
It's like a doctor in your pocket. So, let's just make that clear. It's never to replace the doctor. And the biggest threat to anybody is probably Dr. Google. Because if you go and put in your symptoms in Dr. Google, you'll probably be dead by the end of the day. So medical expertise is always the best. But the access to that is very difficult and very expensive. So it's just economies of scale. And if you cannot get to them, and once you get to them, I mean, if you're in South Africa and you're on a medical scheme and you're very diligent and you're registered as a PMB patient for your chronic condition, that means minimum prescribed benefits. That is a legal thing that you have to pay the benefits. You can see your doctor twice a year for your chronic condition. The average doctor sees you for 10 minutes. So let's be generous, say 15 minutes. You can see your doctor for half an hour a year on your chronic condition.
And that's supposed to be enough to manage it for the entire year.
If you do not manage it yourself and make sure that you do all the things that you should do, you will not be a healthy person. And by the time that you see your doctor for the second time that year, your symptoms can have been increased dramatically. You can have secondary conditions and tertiary conditions developing because of that. And by the time you get there, they can't do anything. So health coaching fills an extremely important void to help the individual to optimize their health. And then we are employing tech with that so that we get a lot more information and data on the client or the patient so that we can give them much better feedback and instructions on how to optimize their health.
Very good, very manageable. Still, like I said, a brand new product, very difficult to get across and get people to understand and sort of get this new kind of lifestyle or like a new kind of health treatment. Because understandably, looking at 100 years ago, like you mentioned, life was completely different. We're sitting, we're doing manual labor and our calories are quite well controlled. Now it's completely inverted and people are sitting with these chronic conditions are developing from a society that is advancing. I mean, I think it's a good sign in society that we're actually getting these conditions because it shows that we are developing on our production. But the thing is that the threat is still there and it's live. And if it's left untreated, it can cause innumerous effects on everyone. So of those chronic conditions, what are they exactly? And what are the most alarming ones, would you say? And what are the ones that can be best treated with, let's say, like by exercising properly or looking after your diet? How will that improve the chronic conditions?
Okay, so let's look at it differently. In 1923, penicillin was discovered by Alexander Fleming. in 1906, around there, the world population was 500 million people. And the life expectancy in Europe was 36 for male and 37 odd for female. So after that, and in 1934, the first vaccine was discovered. So you can track the explosion of world population on the discovery of medicine and tech. And that is driven all this. What it has shown is that with the growth, you need a lot more economic activity. So therefore, you need a lot more labor. And as the abundance has started to grow, the first things that obviously obesity, and then cardiovascular and diabetes has come up. Now, just to pick on diabetes for a second, you can speak to anybody that's into productivity, and they will tell you that you can do whatever you want. An insulin-dependent diabetic can never be pushed beyond 60% of productivity.
Sure.
They just don't have the energy.
Yeah.
The same with, so the World Health Organization classified 27 chronic conditions, chronic conditions as the recognized chronic conditions, and then the 28th, which is an infectious disease, is HIV, but it is deemed a chronic condition these days. Chronic HIV-infected patients, although so well controlled that you cannot detect a viral load at all, don't have the energy to work optimally for an 8-hour day. So chronic conditions affects the individual's energy system so that they cannot perform really like they should. So the negative effect of that is that organizations must employ more people to get the same output, because the people that they employ cannot perform like they should. So if you ask any CEO, they will tell you that ideally they want their employees to perform like a high-performance athlete. Well, a high-performance athlete like Usain Bolt needs to run for 9.6 seconds and then he's finished for the day.
Yeah.
But you want your employee to work optimally for 8 hours a day so that you can maximize that. And that doesn't happen. So we have a very big call center, and on the back of a study that was done first in the US and then at Northwest University in South Africa, they found that maize meal is a very complex carbohydrate. And if you're not an Aztec or a Mexican that's got the chemical composition in your stomach to break it down, you go into a negative energy state when you eat 500 grams of meal or millipap. If you're South African, you will know that's what's millipap. And in breaking it down, you go into a negative energy state. And when the body has absorbed it, it doesn't know what to do with it, so it stores it as fat. And that is causing so many problems, and it drives obesity. Now, in our call center, we banned, this is pre-COVID, we banned that for lunch, and we gave them proper food. Our productivity went up 35% in the afternoon. So
just from swapping out from lunch.
And giving them very good food, whole food that was freshly prepared, and they had that energy to drive through the afternoon. So your biggest drivers on chronic conditions that's got the biggest effect on the economy is obesity, cardiovascular, and type 2 diabetes. Now, if you are making insulin, it's a good business model, because the projection is by 2025, there will be 2.2 billion insulin-dependent diabetics on Earth.
Sure.
There's only 5 factories in the world that make insulin, and they all belong to one company. So saying that there's 2.2 billion insulin-dependent diabetics is not to say that they will get the insulin. So early onset blindness will be driven by that, which will make them economically inactive immediately. And then the probability of lower leg amputations will also then come into play. So all those economic factors. So let me give you an idea. In 2006, I built a pharmacoeconomic model to look at early detection, early intervention, because that's what we want to detect it early, so that you can do an intervention and then give the patient the right information so that they can make the right decisions on their own healthcare. And we took a middle class middle manager, 42 years old, and looked at the variabilities. If you do, they develop a chronic condition, age onset chronic condition, and you can do the early detection, do the intervention, keep them economically active, keep the family intact and economically active, and they've got disposable income into the greater community, and look at the macroeconomic effect of that. In contrast to where the same individual develops a age onset chronic condition, it is not detected early, it progresses through the stages, and they become they cannot work anymore, and they become financially destitute. They become a burden on society, families fall apart, and the macroeconomic effect on that, on a 40-year work life projected in 2006 was 70 million rand.
70 million from one
individual.
Sure.
Now multiply that by 1 million, and you see what that can do to an economy.
Yeah.
So various bodies in the world has declared that the biggest economic threat in the world is uncontrolled chronic conditions. Now in 1994 already, a previous director of the CIA wrote a book about the 4 billion useless eaters. So it sounds very harsh, but if you've got that amount of people that has got uncontrolled chronic conditions and they're a burden on society, somebody else must look after them.
Yeah.
So the whole drive for us is, first of all, is to help people to understand their own health and what they should do about it, because people are often scared about that, because the doctors use these highfalutin medical terms and the pharmacists just continue that, and then the nurse will just mirror what the doctor said, and they don't really know what to do and what. So we want to break it down to layman's terms, to give people the right actions to follow, to give them hope.
Yeah.
That's the big thing, is to give them hope that you can manage it yourself. You don't need big pharma for all of it. You don't need to see the doctor every week. You don't need to drink millions of medications. You can, by the interventions that you do yourself, you can drive yourself to optimal health.
Yeah.
And people with optimal health performs better in the marketplace. And I said to people this morning...
Sorry, but not just the marketplace, but I think in their personal lives as well.
Absolutely. Absolutely.
Relationships and everything. Yeah.
And everything starts with the relationships. I mean, and sick people never create wealth, but when you're sick, you need wealth.
Oh, especially, yeah.
Yeah. So that is the whole drive behind health coaching, and making it accessible. That's a big thing. I mean, we all know that pre-1997, nobody knew they needed a cell phone. Now...
You can't be caught without one.
Yeah, you'd rather stay home than go somewhere without that. So therefore, it must be mobile. And so our platform is mobile. It works anywhere. It works in all languages. So it's a real, and it's small bite-sized learning. And then you've got access to a health coach, a human being that you can speak to. We see it as the optimal education system for your health. But education only works when you partake.
Yeah.
And that's the crux around this, is to get people involved, to help them to partake and understand it, and get the excitement of getting their health optimally so that they can live a long and healthy life.
Yeah. The early detection is a very important strategy in this chronic condition management. How can people, let's just everyday people with technology that they already have access to, how could they somewhat detect if they have a chronic condition, or how could they test for it?
It starts with mindfulness. Knowing that you weigh a certain amount of kilograms. So the access to a scale is extremely easy. And if you just keep record of that, once a month, twice a year, whatever, you will be able to see that, hey, my weight's going up. And I'm not turning into Arnold Schwarzenegger, so I'm probably putting on weight on all the wrong places. Yeah. So that's the first thing. Then go to your local clinic, have your blood glucose done, have your cholesterol done, have a blood pressure done. The basic things, because the basic things are all indicators that there might be something wrong. And then we can start digging. If you eat pizza 4 nights a week, you should know that something is going to go wrong. If you eat handful of salt on your food, something is going to go wrong. So anything that's extreme always lead to something that's going to go wrong. When you've got access to technology, things start to get easier. Some of the technology is still quite expensive, but the advancement in technology is phenomenal. I mean, we are rolling out now a system where you use your telephone, which everybody's got. The camera on your phone will scan your face. The technology look at the blood flow under the skin. Just from that, with this advanced AI technology that we use, we can get 34 biomarkers from you without sticking a needle in you.
Sure.
What's the benefit?
How long does a scan take?
It takes exactly 30 seconds. Then when we go to the advanced part, the scan takes 2 minutes. And that's it.
Sure.
So it doesn't matter where you live. If you've got cell phone reception, which mostly everybody's got, you can use the system.
Hopefully with Starlink, then there's no excuse to not
There's
have.
absolutely no excuse. Hopefully that will happen soon. So the technology is growing so fast and advancing so fast that within the next 2-3 years, nobody will have an excuse to say, I didn't know. No, you didn't want to know. Because if you knew, you had to start to make adjustments in your life. And then you have to stop drinking that 15 brandies on a Saturday evening while you watch the Springboks play, or eating the wrong food, or not sleeping enough or sleeping too much, not exercising, not understanding what your heart rate is, and that you must elevate your heart rate with a certain amount at least 3 times a week. So get off the couch, throw away your TV remote and actually just walk through the TV and change the channel if you want to.
Like in the old days, we have to, if it's not working, then you slap the TV on top as well.
Or you send your children to go and do it if you had children.
The first remote.
So it boils down to one thing and one thing only. Take accountability for your own health, your own life. Nobody's coming to rescue you. It's not somebody else's fault. Once you realize that your success in your life is in your hands, and if it's going to be, it's up to me, then everything changes. And we see it. I mean, the exciting part, obviously, is the healthy people engage with us first. Yes. Because they want to make sure they're healthy. Yep. They want to make sure that they move to a place where they're ultra healthy, where they can live for 100 years, where they can pick up their grandchildren and carry them for 10 minutes, so that you're not a burden on society. Those are the high flyers, the goers, that they want to change. Unfortunately, there's a part of society that need a bit more encouragement to get going. And when we see it often, there's nobody, we always fight with the smokers, and there's nobody as motivated to stop smoking as a guy that's just been diagnosed with cancer. Yeah. I've seen it so many times. Nobody's as motivated to start training when they've just been diagnosed as a diabetic.
Yes.
So it is, but why does it take an event?
Yeah, why does it take so long?
Yes.
To get there?
And a serious diagnosis like, listen, bud, if you had plans for next Christmas, maybe you should cancel that, because this is not going to happen. It's amazing how the mindset change and how people start to move on. And that's the role of a health coach, is to, when that happens, or hopefully before that happens, is to guide people on that road to optimal health.
Yeah. That's what you spoke about now, is when you say like the people that come in there are already motivated, the people that already are healthy, they come first to double check, and then other people take a little bit longer to get motivated. People are all the same between each other. Like, they all want to be healthy, they all want to live longer. But what does it take? What's that first step to take for the people that aren't motivated, that aren't healthy yet? What's the switch that needs to happen in order for them, besides the diagnosing of cancer or diabetes, What's the switch, that preventative switch that needs to happen so that they can go and take that first step and walk the journey?
We spent a lot of time looking at that, and we consulted wide on that. There's only one motivator in the world. It really works. Money.
Money makes the world go round.
Absolutely. And when you link that to a financial reward or the possibility of losing your financial security, then suddenly it focuses people's minds. So South Africa is a bit different, but in the States, if you've got medical insurance, your medical insurer will tell you, you will. And then everybody does it. In South Africa, we can't do that. So your doctor will tell you, you will. Or your family will tell you, you will. Or even better, your financial advisor will tell you, you will. Because if you don't do this, you'll be penalized on this, you'll lose that kind of benefit, you'll lose this money, you'll lose cover for your life. So the best motivator is money. So, and when people start to see the effect of their health on their financial future, that's normally when the switch happens to say, I better do something about this. Because, I mean, in the environment we work a lot, we know that 96% of South Africans cannot retire financially independent.
96%?
96%.
Sure, that's an alarming figure.
It is huge. It is, I mean, only 4%? Really?
Yeah.
Where are they? Oh, they live in the big houses at the beach and things like that. But we do a comparison for people now. We compare three things for them. We look at their life expectancy, because the actuaries has worked this algorithm out long ago. So they, based on your peer group, they can tell you on your vitals what your life expectancy will be. Then we develop algorithms to calculate your health expectancy. Now, those two are very different. And the example we used, lying in a bed with nappy on and somebody turns to you, that's life expectancy.
Yeah.
But health expectancy is something that you have to work on really hard. And if your health expectancy and life expectancy isn't more or less the same, you know that you're going to be in trouble at the end of your life.
Is health expectancy more like the quality of the health of the life that you live?
Okay. So we've got this graph, and when your health expectancy dips below the middle line, you lose all attention span of that client, because their major expense is suddenly medical expenses.
I see.
So they don't do personal growth anymore. They don't invest money. They don't buy life insurance policies. They only focus on that, because every bit of disposable income they've got is consumed by medical costs.
Yeah.
So you want to move your health expectancy as close to your life expectancy as possible. But then we add a third thing there to show them their financial life expectancy.
Yeah, if you're going to live longer, you better
have more money.
You need to be able to fund it.
Because somebody must pay for that.
Yeah.
So those are normally very sobering ideas for anybody to say, listen, first of all, I better look after my health. But secondly, I better look after my finance as well. Because it doesn't help that I'm so healthy I can live forever and don't have money to live on. Yeah. It's a bit of a difficult one. My father used to say, it's fine when you're poor when you're young, but to be poor when you're old is really a problem.
It must be extremely stressful.
It is.
A lot of people you need to look after.
And you know what? You can go and ask any old person. If you run out of money, you run out of family as well. It's sad, but it's true.
Yeah.
So that's the whole drive, is to get people to understand, listen, this is going to have a financial impact on your life. And when you touch a man's wallet, you touch his heart. And that's where people normally start to listen, to say, listen, I won't be able to work until I'm 90 to support my lifestyle. So I better do something about both of them now and start thinking about my life holistically, not just where am I going to be with my mates on Saturday evening when the Springboks play. So that is where we must get, well, as big a part of the population as we can to, so that we can help them with better decision making.
Yeah, that grey area you're talking about, where you cross that bridge and now all of your finances go towards medical expenses and not healthy living. That sounds like it sounds like a domino effect, where as soon as you cross that line, it starts to spiral down. But there must definitely be a spiral up if you're above that line as well. Can you paint that picture just to help people sort of visualize what the potential of their life could be once they start looking after their health and their finances?
Okay. So the stats say that you use 90% of your medical expenses in the last 9 years of your life.
Sure.
And 90% of that 90% you use in the last 9 months of your life.
So it's hyper concentrated at that end.
Very concentrated. So if you work back, is how do you prevent that? So the biggest cost drivers there is cancer, stroke. Stroke is a big issue, and we're seeing a growth in those figures. So in South Africa, there's about 220,000 strokes every year recorded. So we analyzed 2 years of stroke victims. And what we looked at is the data is to say, what is the optimal care plan for an individual like that? And the optimal care plan for stroke is, according to international standards, there's 8 different medical service providers or medical professionals that must be involved in the rehabilitation. Now, if you think of it, only 1% of people die because of a stroke.
Okay. But their life is heavily impacted after that.
It is, and it varies. So the average hospital stay in South Africa for a stroke victim is 2.75 days. Then they send you home. You survived it, here's your medicine, go home.
Yeah.
If you start your rehabilitation within 6 hours after diagnosis, you can get up to 98% of your cognitive ability back.
Sure.
If you delay that by 7 days, it drops to 60%.
You lose 30% just for that delay
Because
of your cognitive function.
And what happens in that environment? The patient's traumatized, the family's traumatized. So if somebody don't tell them what to do, they're not going to do it.
Yeah.
So what we found is that on over that 440,000 cases, the average amount of medical professionals that was involved was 3.
Out of how many cases?
Out of 440,000, out of the optimal 8
My word.
medical professionals that should be involved to get you to 98% of your cognitive behavior, only 3 was involved.
Sure.
So it's because of that trauma, and the family doesn't know. If they had a health coach, the health coach will say, listen, this is who you should see. So we do this, we do this, we do this. We make an appointment there, we go and make sure that it happens.
Have an action plan set in and then followed through already.
Yes.
Yeah.
So we did a event or an intervention for a company, and we identified, and it was not just stroke victims, but it was across the spectrum, 664 individuals who submitted a claim for disability. So something happened. They had a heart attack or a stroke or whatever. And they were handed over to us, and we said, right, we start the rehabilitation now as it should be done. We will make sure you get to every medical service provider, you do everything that you should, and you follow through, because here's your health coach. All 664 returned to economic activity again. In other words, they could go back to work.
And they're at full function.
Yes. Well, they had enough function to go back to work, which goes a lot for self-esteem, for independent work, for independent living, all those good things. For 664 people, the total rehab account with all service providers was 3.8 million rand. The amount of money we saved for the company that would have paid out on the disability claim was 370 million rand.
Jeez. We only paid, what, around
3.8
about 1%?
1%.
Yeah.
So that's what can be done with intensive health coaching and making sure that everything around that happens. Now, if you extrapolate that to a bigger population and you see what the economic impact is on the market, you see why health coaching is so important, that we get a much larger portion of the population, a health coach that can help them to optimize their health.
Sounds like looking after your health is a good solution to get solar installed in your house, because now you can afford it if you look after your health.
Absolutely.
Solve the electricity crisis.
Yeah, that 5-year payback that you need to get to be able to recover your return on investment.
Yeah.
You need health, to be able to get there.
Yeah.
And just imagine you've got emphysema and you're on oxygen, and suddenly the power goes off, and you don't have power or battery backup, and then it becomes a problem. Then they say that money is not important, but it's much like oxygen. It's very important when you need it.
Yeah.
So it is, and a good health is important. What do you do without health? Ask people that's sick. They don't do anything. They are so concentrating on just staying alive that they don't enjoy life.
Yeah.
And there's so much in life to enjoy. They can't enjoy their families, their children. They can't enjoy their friends. They can't enjoy sport or the outdoors, whatever. So having a healthy body just makes life so much better. And then when you very mindful, and because the one thing that people don't like to talk about is mental health.
Yeah, it's a very sensitive subject.
It's very sensitive.
Yeah.
And mental health is spiraling. You, like in South Africa, you can find a lot of acute beds in hospitals. But if you go and find psychiatric beds for mental health patients, very few, very few.
Yeah.
In Gauteng, for a population of 13 million, there are less than 400 beds.
That's certainly not enough.
No, it's not enough. And people think mental health, it's the crazies. No. Burnout is the biggest mental health issue at the moment. And we can measure burnout now with bloods. We can measure burnouts with a facial scan. But burnout is a lack of acetylcholine in the brain. Your chemical neurotransmitters in the brain doesn't work like it should. And that is the leading cause of 25% of our population suffering severe depression. You can have a healthy body if you're depressed, you cannot perform optimally in life.
Yeah.
There's a big stigma. People first of all, they don't know the questions to ask. I'm feeling like this. I'm feeling like I'm going to die every day, but I'm not dying. And
yeah, so I must just carry on.
And
everyone says I must just be strong and carry on going. Yeah.
Suck it up, buttercup, and go on.
Yeah.
And the society is not equipped to recognize it. There's a huge stigma in going to a mental health professional.
Yeah.
But sometimes when people get there, they need so much therapy that it costs a lot more.
Yeah.
So by talking about it more, by giving people self-assessment tools that they can see if something is not going right, that is the important part. And that all comes out in health coaching.
Yeah. It sounds as well like mental health must be treated the exact same as a chronic condition. I mean, it is something that creeps up without people knowing until it's too late.
Yes. And then you read in the newspapers that a father killed himself and 3 children and things like that. But if it was recognized earlier on.
Yeah, that would never have happened.
No, it would never have happened. So, but that's the extreme. I mean, so many people, because of bad mental health, start then to develop all the other physical chronic conditions because they don't have the coping skills. They don't know how to cope with the stress. And stress gets your body to secrete cortisol. Cortisol is the organ killer. And then the diabetes starts and all the other things. So, I mean, we all say it all starts here.
Yeah.
So, mental health is something that people should talk about often. But people go and see their GP and then they say, well, I've got flu. Or I've got an ingrown toenail, and that's being treated. There's not a holistic approach. Health coaching is about a holistic approach, and it's mind and body. Those two go together. If you take the one away, the other one falls apart. So it's important that we look at everything holistically and a holistic individual, and don't put them in compartments so that we only treat one, but we treat the whole.
Yeah, the whole system.
Yeah.
So, having a look at both the mind and the body, what are the most important areas in there that paints this picture of holistic health?
It's mindset. It always starts with mindset, because mindset drives, I want to know more or I don't want to know. I will do something or I won't do anything. So, and then belief systems. what do I believe? What have I been taught to believe? What am I responsible for? What am I not responsible for? Everything starts with mindset. Mindset can be changed by education. When people start to know that you have access to this, you can make a different decision. You're not just reliant on somebody else's opinion.
Yeah.
All that. So the more people get into contact with that and understand that I can make a different decision. I can change my mind. I can do different things. I can eat better food. I can exercise. Whatever. Then people start to change. And then when they know that they've got a place where they can access what they need in a safe environment without being judged or anything, then it starts to change.
And they really start to flourish and
Yes.
start to come out.
Yeah. And we see it all the time. And when you get a person beyond a certain point, and it differs for every person, where they start to see the results in their life. They see the results in their health and their relationships and their performance and everything. I mean, they become these raving fans and brand ambassadors because they want to tell everybody how well it's doing, and they get all the compliments and, oh, you look so fantastic. You lost so much weight and you work so much better. And that's where the success start coming in. And that's where you start building this happy community, happy nation. And I mean, if you can move away from the negative into the positive, then all the good things start to happen.
It's all about empowering the individual.
Yes.
To empower the individual by giving the power to them in their hands.
And that they can get away from that sitting in a pool of self-pity and feeling sorry for themselves because nobody understands me, nobody can do anything, but that you become part of something bigger and that you can drive that and get out of your own head and see that there's a better solution and that you can. And often they become the best advocates for that because I did it and it changed my life.
Something that they're very proud of.
Yes.
Yeah.
Yeah. I mean, the person that loses 25 kilos and can get the two knee replacements and play better golf and is 3 centimeters taller.
Yeah. It's just a win.
It's absolutely.
Yeah.
And now that person is much more focused on, no. We live healthily. We do this. We do that. And understand it, and is part of now a community, and it's got an accountability partner to make sure, well, I have to report back. So I cannot do all these things because I'm going to feel guilty if I report back. And once you've got that, it becomes self-propelling, and then people start looking after themselves because they can remember what it was when I felt like that, when I couldn't go on a golf course because I can't walk. I couldn't hit a golf ball because I really love golf, and I was carrying too much weight. I was always out of breath. I was a type 2 diabetic, all these things. And suddenly, now I feel fantastic. I'm not a diabetic anymore. I've lost all the weight. Life's good. Why would I want to go back to there? And that's where we want to get people to.
To get people to not surviving, but thriving.
Yes. No, absolutely.
Yeah.
Life is meant to thrive.
Yeah.
And to thrive, you need health and wealth.
That's very true,
Yeah. But mindset, when you get the mindset right about health, the wealth tends to follow.
It's quite a common story where people work their whole life, they dedicate all their life to their work, they earn lots of money, and then they come to the later years of their life and they can't spend it properly because they're all sick and debilitated. We're talking about preventing people to get there, and that is pertaining more towards the younger population. But if someone's very close there already, again, what is that switch for that certain person in that spot? How will we get them? Because they hate exercise. Let's face it. They think it's completely demonized. It's terrible. What must change in their mindset? What is the thought that needs to go through their mind? Because they've got the money now. So finances is not a big motivator. It's something else within. What can they think of to motivate them to now make a change and better their health?
My experience in that is when you start talking to them about purpose, because you can have a variety of purposes in your life because every age group in your life brings a different purpose. And when people start focusing on that, because often when people are very successful in business, for instance, and they sell the business their purposeful drive is gone because they sold the business. Yeah, it's sitting with a heap of money now, and they don't have to worry about money, but that drive, that purpose is gone. To help people to find a new purpose, something to focus on. That old thing and say, where focus go, energy flows.
Yes.
When you start doing that, when you start developing a new purpose, and there's reason, yeah, I'm 75 years old, and what must I do?
Yeah.
Well, you can live for another 20 years. What difference can you make? How can you help other people?
Yeah.
And we find our purpose in the service of other people. That's how we were put together. The selfish one lives on an island and never sees anybody else. They're not happy people.
They're isolated.
Yes. Yeah. So helping people like that to define a new purpose, and invariably it is in service of others. And that's where I start to focus again. And if I want to do that, then I need to be able to walk. I need to be able to do this. And by driving the purpose, the exercise and the moving around starts to happen automatically, because suddenly, no, I must be there, and I must get ready, and I must get in my car, and I must walk there. And so they don't have to go to the gym. They don't have to run a marathon or anything. But by getting active, that starts to happen. And then they start thinking about their health again. And because if I'm sick tomorrow, I'm going to let a lot of people down, and I cannot do that. So it's all that of finding new purpose and driving that.
Okay. Thank you, Dr. Richard Botha, for taking the time to share your insights with us.
Thanks, Jordan.
My name is Jordan Joubert, and this is From Seed to Success. Thank you to the audience for taking the time to listen to us talk. And if you would like to see more, please look at the links in the description below. Have a lovely day.